We start off with the session on hacking the health system for entrepreneurs. And in this session, we are going to cover the building block of health management information system. So what is a system? A system is a collection of components that work together to achieve a common objective. An information system is again a cooperation of those components, but it utilizes information in the process. Health information system focuses on health information and using it for betterment of health. Health management information system doesn't just use the information of health, but also uses this information for managing healthcare processes, improving their efficiency, improving their effectiveness, improving the overall planning and the management and the care and service delivery. There are other terms when we talk about HMIS we need to know. One of them is EMR, electronic medical record, which basically focuses on the medical disease history of the patient. There is another term called as EHR, electronic health record. It focuses on the overall health of the patient. And then there is another larger term, broader version, which is called as HMIS, Health Management Information System. It includes all the data of health, but at the same time, it also includes data that helps in management of the overall health system. WHO recommends, and they have developed a practical guide, this is quite a few years old now, on how to develop health management information systems. And they say that you need to follow these 10 steps. So the first step is that you need to review the existing system. The next step is that you need to define the data needs of the relevant units. Then the next thing is determine the most appropriate and effective data flow, design the data collection tool, develop procedures and mechanisms where you will be processing this data that you will be gathering, and then develop a training program so that you can implement this HMIS. Pre-test this system prior to you take it full flow in the health system. Look at the data collection process, look at the data flow, look at the data processing, look at the data utilization. Also monitor and evaluate this system. Develop effective data dissemination and feedback mechanism, and overall keep on working to improve the HMIS. So if you look at the first step of developing any HMIS, which is reviewing the existing system, you need to go and see how data is being collected in the existing health system. So that could be in the form of forms, that could be through logbooks, that could be through any form of record keeping. Now, determine the current status of the HMIS, look at the data processing, look at the analysis, look at the dissemination, supply and logistics, staff development, coordination, and cooperation communication within and between different units of the Ministry of Health, or in your case a hospital or a startup. The next thing is then you need to review the existing system. So you need to look at its accuracy, the completeness of data, the adequacy of the data, the timeliness of data collection. Identify the aspects of the system that you think need to be retained, identify things that need to be modified, and identify things that will be removed. That this can be done at the level of a village, this can be done at the level of a district, a province, or a nation, and you can develop checklists around this, whether or not there is being any duplication of forms, whether or not too many forms are being collected, that's taking up too much of the time of the health professionals. Now, you can look up this list. This is available on the WHO document. Moving on, you need to then define what are the data needs. So you need to first identify at what level you're working on. Are you working at the level of village? Are you working at the level of district? Are you working at the level of province? Are you working at the national level? So at the level of the village, you need to focus on identifying cases, identifying issues with service delivery. At the level of district, you need to have a more broader spectrum view and focus on monitoring and supervision. In the province also you need to focus on the monitoring and supervision with a broader spectrum. At the national level, you don't just need to focus on the monitoring and supervision, but also need to focus on policy formulation. These are some of the indicators. For example, say you are developing in HMIS, so and your primary objective is to improve the coverage of immunization by 20% in that year. Then, so what are the inputs that will go into it? What are the outputs that you expect? And then what is the overall impact of the system that you are planning to create? Identifying data needs at different levels means that you will first identify what are the sources of data. You identify the frequency of collection. You will identify who at the district level, provincial level, national level is going to provide this data. The next thing is determining the data flow. Determine what data will be submitted to whom. Determine how frequently that data should be submitted. Determine in what form that data will be submitted. Make a flowchart that shows the flow of information from the peripheral to the highest level. Now, remember that data flows from the peripheries to the highest level, so workflow or data flow needs to be developed around that. This is again a grid pattern understanding of that. You must develop flow diagrams on how data is traveled, who is the point person responsible for data sharing, for data curating, for data managing. And then designing the data collection tool and the reporting tools. So that can initially be done using key issues in that area, or key issues in the, if you're developing say a startup in mental health, what are the key issues in mental health for that specific country. So you need to identify the data elements, you need to categorize those elements, then define, and then eventually develop an instruction plan for how that data will be collected. It's important to develop procedures for data processing. Why? Because there is a lot of cost involved and the availability of personnel with proper background might not be there. Availability of technical support might not be there. Therefore, it is important to think about where you're working on, in what context you are going to implement this system. Also look at how you are going to identify bugs, errors, redundancies, ability of the software to generate the expected data, ability of the staff to use it, all of those things. How will you do that? The next thing would be developing of a training program. So you can develop a training program at the level of managers. You can develop a training program for data providers at peripheral level. You can train the computer operators, you can train the other staff. Identify who your target group is, what is the content of the training that you're going to give, what will be the strategies that would go down in this training, and what would be the duration of this training. Training types can be very different from one another. They can be very small trainings, very lengthy trainings. The next thing would be pre-test the system. So where are you going to pre-test it? Identify a pilot site. Who will be pre-testing it? What would be the specific objectives of the pre-testing? How and what modes and tools for data collection will be utilized? And how long will you be pre-testing? It's important to monitor and evaluate the system. So identify what you want to monitor and evaluate. Identify how frequently you will do that. Identify how you disseminate this, and how will actions resulting from evaluation, how would you take action on the data that you get, on the information that you get. Now, other thing is, how would you disseminate the data that you have? You need to give it to the required stakeholders. For that, you need to identify who your target audience is, what is it that you're trying to cover, what is the effect of the feedback system, what is the degree of utilization by target audience. If you were to enhance the HMIS that you have developed or is already there, so you will have to develop capacity, develop strategies around it. You would have to establish inter and intra-social linkages. You will have to identify and coordinate those initiatives. So it's a lengthy process. It's not a 1 year, 2 year process. It's a lengthy process. It requires a lot of behavior change. So, and also you must always have an eyesight into what you want to do next. An example of HMIS in low and middle income countries is DHIS, which is District Health Information System. DHIS2 has certain forms that can be filled in. These can be digitized. These forms are already digitized. DHIS2 is already digitized. There is another open source EMR called as OpenEMR. You can download it from GitHub. It basically was developed by Imperial College. So you can use it if you are a young startup. Other than that, there are other human resource management softwares. For example, IHRIS developed by USAID, DHIS2. All of these are available on GitHub. Then on top of that, there are other EMRs that are available, freely available, and you can look at whether or not they are HIPAA compliant. HIPAA compliance is a big issue when it comes to EMRs. We'll do a separate session on HIPAA compliance. So Clear Health, Cottage Med, Free Med, you can find all of these. You can look up all of these on Google, or you can also look up a lot of these on GitHub. OpenEMR, OpenMRS, all of these are here. So I hope this was helpful. The most important thing as an entrepreneur is that you must understand where you're going to implement the healthcare startup. So if you know your market, if you know the situation, you will not be imperiled. Thank you. All the best.